Thanks to the organizers for giving me an opportunity. And the topic I am going to speak about is a bit of seeming to be a controversial issue. Surgical care in Ayurveda by 2047, is it an enigma or a reality? Of course, if you go into the history of surgery in Ayurveda is a unique form of development of a gradual intervention with the body physical functions. It's a perfect blend of medical and surgical disciplines is the identity of Ayurvedic surgery. If you look at the protocols of the treatment, it starts with Antaparimarjana, Bahiparimarjana, and when this Bahiparimarjana also is not able to produce the results, then the Shastra Pranidhana. It's a gradual increase in the level of intervention. When it comes to the question of Shastra Pranidhana, surgical intervention too, it starts with the bloodletting, Rakta Mokshana first, and then the later on removal of the dead tissues. So when Shodhana is targeting at removal of the vitiated tissues from the body, the Shastra Kriya is an advanced, still more advanced method of removing those defective constituents of the body. And so that kind of a perfect blend of medicine and surgery is a unique identity of Ayurveda. At the same time, Sushruta Samhita is one of the texts which was written so long ago, where the training protocols of the surgery, even experimental model for the surgery, and every aspect of the surgery is discussed in detail, which is a model as such, which remains as a model even now. One of the very unique identity of Ayurvedic surgery is the surgery is done only as a last resort, only when other treatment has failed. Now, tatra shastra sadhyeshu snehati kriya naptati siddhate, snehati kriya sadhyeshu shastra karma na kriyate. Now, again, main purpose is not to go into the history part, but there is a very brief issue. The issue is the Western surgery. If you go into the history of Western surgery, it was in the hands of the barbers, and it was not really a part of the medical system till 1840s. In late 19th century, that the surgery has become a part of the medical institution. Till then, surgery was considered to be a non-medical and barbarian, that word barbarian. And in the West, it was in the hands of the barbers, not of the physicians. Now, in contrast, Ayurveda has developed that surgery in a very close coordination with the medical discipline. That's the very unique identity of Ayurveda as such. The quotation which I am just showing on the slide is a quotation of one of the MPs in 1811, when there was a discussion about the inclusion of surgery in the medicine. So all the history of contemporary surgery in the Western science is just around plus 2,000 years, 200 years plus. That's the history as such. But it's a fact that it has grown to such a level where it has overtaken all. And now we are in a situation, critical situation, where if I say that there is an Ayurvedic surgery, people will look at awe. And a person who says that I'm practicing Ayurvedic surgery would be considered as a odd person in an odd situation. In present situation, globally, surgery has become very common intervention, and over 200 millions of surgeries are performed annually. And almost every system has now become a subject of surgery. It's not only a few classified surgical diseases. Surgical intervention has gone into every area of the medical discipline. Now, there is an important paradox, an issue of paradox. Now, all these issues I am just discussing to highlight what should be the identity of Ayurvedic surgery. Now, the paradox with Ayurvedic it's contemporary surgery is the surgical access is not uniform. There is no the surgical access in certain areas is quite high, and the number of avoidable deaths due to non-availability of surgical access is quite significant, and it's much more than what the death could occur due to injury or AIDS and so on. At the same time, the other way, there is another issue is the Sept surgery. The other surgery, WHO has released a very unique document about the Sept surgery in 2011, and that document itself would be presented with all the possible complications that occur due to the surgery and how to prevent, and that's the major issues. The reported complications due to the surgery also are quite high, and one of the major important issues is the unnecessary surgeries being done. the access to the surgical facilities, that to safe surgical facilities, is not uniform, and India is one of that country where the surgical access is quite low. Now these dark colors, they suggest about a low surgical access, whereas the light colors, they suggest a better surgical access. Now at this situation, the other way, there is a important issue with the contemporary surgery, and that's about the need for surgical conservatism. Now surgery has gone to that level where every organ of the body is being handled surgically, and the surgical indications have now gone many-fold, much more than earlier. Almost every disease is being treated surgically. At that situation, there is another issue of having a need for surgical conservatism. And these data and the references I am just showing on the slide, they are from peer-reviewed journals where the same problem is discussed. I am not going into the discussion of the reason for this excessive surgery or unnecessary surgery, but it's one of the very significantly debated issue in the field of scientific approach to the surgery. Now, it's not limited to, that issue is not limited to only the scientific field and medical journals. It has percolated to the general medium, the news medium also. And once the issue has come into the news medium, the words selected would be very horrible, and the image of the surgery and image of the our medical profession would be at crossroads. Like they may select any of the words, no holds barred, that kind of a situation. And that's one of the important issues which every person who is involved in the medical profession should be concerned. Now, at this point, the question comes in like whether Ayurvedic surgery should be a separate identity, should have a separate identity, or whether Ayurvedic surgery is just a copycat of the contemporary surgery. These are the discussions which are present over there. As far as the current situation is that, of course, Kshara Sutra in fistula, it has become a unique therapeutic approach and is on the verge of getting a complete global recognition. Of course, it has already gained a significant global recognition. So that's a significant contribution from Ayurvedic side to the surgery. Beyond that, beyond Kshara Sutra and the anorectal issues, surgery in Ayurveda is still practicable and still it's a need of the day, or it's a need of the future too. From that point of view, these are the issues which we need to consider. Surgical conservatism, that's surgery being done only when it is absolutely necessary, or extending the indications or the guidelines for the surgery, is one of the important possibilities by which we can contribute a lot to the suffering of the people. And of course, post-operative care with Ayurvedic approach, Ayurvedic medicines, which can be used to promote the wound healing, or even the other complications of the surgery could be minimized to the Ayurvedic medicine, is another area where we can contribute a lot. And of course, another important issue is a safe surgical care can reach to the area where there is a need, like a rural area, a contemporary surgery and the surgical facility, because the current surgery is significantly focused over technology, high technology surgeries. They cannot reach to the area where you have lesser facilities, lesser infrastructure, like a rural area, whereas a Ayurvedic surgeon can reach to that area. So from these important points, there is a need to have an identity of Ayurvedic surgery. Of course, identity of Ayurvedic surgery also is an absolute necessity to evolve a national medical system by synthesizing the best of the traditional ideology with the modern technology. When we say the modern technology to be adopted, surgery is one of the fields where the technology can be adopted easily. Now, to establish what we can do, I am just giving you the data of my treatment, my records of patients. When I started practice in 1983 to 85, in the initial days of my practice, the number of surgery, ratio of the conditions, just I am giving a few of the examples. This is just one way. By combining Ayurvedic treatment of Agnidipan and Anulomana in the treatment of hemorrhoids, the number of surgeries which we can do, which we can avoid, is quite significant. This number shows the number of patients whom I have treated during the span of, in a gap of 5 years. I have just shown you that graph in the these gaps of 5 years. to make this graph visible, the number of cases which we could treat without surgery and is quite significant. I'm just giving a few of the examples. In case of appendicitis, it's again the same, like the number of surgeries which I do has gradually diminished, whereas number of patients whom I am seeing is increasing. Now, this kind of an image is a need of the day, and interestingly, many patients whom I see, they come for that kind of a target, where whether they can avoid surgery or not. A good number of patients who have already got an appointment elsewhere for surgery, before the surgery, they want to have a second opinion, like whether we can avoid surgery or not. Avoiding surgery is not only in these two conditions, there could be many possibilities. I'm just, with the time limitations, I can't go into all that, but I'm just showing some of the major areas where we can produce a significant change in the need for surgery to a very significant extent. Spinal surgeries in IVD, it can be reduced to a great extent, and a large number of patients who might treat, they are of that category where surgery could be advised. Surgery might have been advised, and we can avoid surgery with combining with diabetic treatment like catibasti or the neurovascular, etc. BPH, cholecystitis, and in the diabetic food conditions, I have an impression or image in the society of a limb-saving surgeon. So, of course, these are all, I'm not highlighting my performance, and my purpose of showing or suggesting about this is not to show a one-upmanship, but it's about the highlight about the need of an identity for Ayurvedic surgeons. Because one of the major issues now is our current generation of Ayurvedic surgeons, many times they follow the technology and they feel like they try to cope or maybe overtake the contemporary surgeons in terms of following the technology. I think it's not necessary. We need not be in a position of racing or competing. It can be our role can be in a sort of, we can have a silo or we can have a unique formation for our own identity, and that identity would be of a surgical conservatism. Now, there is another aspect of this. Just for the sake of highlighting or maybe showing the need, like to justify whatever I'm going to say, I'm just giving you a history of one case. Of course, I could have quoted hundreds of cases. This is about one patient whom I have treated in 2017. A boy met with the road accident and he had a complex fracture of the ankle, but he was referred to a tertiary care center in Bangalore because of the need for a more sophisticated intervention. Of course, the case was complicated, and a disarticulation of the ankle was done on the date like 2nd December 2017. And the patient had developed, again, ischemia, the necrosis of the proximal area. And again, there was a second revision of the amputation. Below the amputation was done on 16th. And still the patient had some complications, of course, during this course of the treatment in that high-tech hospital. Everything was being done. Doppler studies was done on 22nd, and it showed femoral artery thrombosis. And the patient was advised about another third amputation, knee amputation on 24th. Now, at this level, because the patient's party hails from a poor family, and you can even appreciate the stress on any person when she has to undergo a third amputation within a month or so in a young boy. Naturally, there will be a lot of stress, and moreover, by this time the patient's family had spent a fortune, and at the end, I usually say one a bit lighter word is "Jiska koi nahi hai, uska to STM hai." So when most of the patients who get frustrated, they come to SDM Ayurvedic Hospital. And of course, again, jokingly, a later said, my name is written in the case sheet by our staff as Yam Sharma. I read it often as Yama Sharma because the mortality figures of my patients are quite high. Because a large number, at least 1 in 6 patients whom I treat, they come from that category where they have lost the hope or they are not able to cope up with the requirement of the contemporary system, and they come to Ayurvedic hospital. So this patient also came in a very critical condition, toxic situation, and the whole the stump was amputated, stump was necrosed as the patient's general condition was quite poor, and in that state, the patient came to us with virtually very little hopes by the patient's part. Now, what I did was, I did just a minor debridement of the area, and I started with the oldest of the antibiotics, gentamicin. Because
a quick time alert.
fine. Now I'm just at the end of it. Within 2 minutes, finish.
Thank you.
So now this patient was treated with the Manjistatic Sharavasti, and you can see the progress within 5-6 days. There was a real vascularity, and the patient's it was revised. It's the suture, resuture. Some was pre-suture, and the patient had a good healing, and the total picture ends with now the patient has a artificial limb and doing his normal activity. Now all this is not to highlight about what I am just doing. Just it's about the points to which we have to consider. Whether an informed choice could have avoided the choice of frustration. The patient's party came to me at the frustration. Was it necessary? The negativism, now one of negativism is by the time the patient was discharged against medical advice from the other hospital, they had to give an indemnity bond, like by going to Ayurvedic hospital, I am wholly responsible for my care. Now, whether that kind of animosity could have been avoided or a synthetic approach could have reduced the suffering. And hence, in the future, what I am just suggesting is Ayurvedic surgery should maintain that identity of safe and conservative surgery, and we should target about wider public acceptance so that the policy makers, they can be in a strengthened to have a adoptable policy. And adoption of reasonable established technology is the important thing. It's not that every technology which comes in should be followed. And of course, in this kind of situation, hostility and trade union mentality should be replaced by concern for the common. Building an environment of cooperation and collaboration to evolve national identity system is, I think that it is not impossible. It's difficult. Now, just this is about the news report of the Supreme Court case. Now, when the government has issued a gazette notification about Ayurvedic surgery, the issue is now under the Supreme Court, and in the Supreme Court, the pleading was a right to life in Jeopardy is because of Ayush doctors. Now, whether this in this kind of environment, whether a synthesis is possible or not, I would still say it's not impossible. It's difficult. With this, let me thank you. Thank you. I said, and I would expect some feedbacks in due course of that. Right. Thank you.
Thank you, Sharma, Vaidya Sharma ji.
Thanks a lot. Unfortunately, we're not able to hear from the auditorium.
Okay.
Ashwini is, in fact, thanking you. She's on the podium, but
whether they could hear me or not.
Yeah, we could hear you. We could hear him. We'll move to the.
Stay on until Ashwini introduces him.
Okay.
Yeah.
Yeah.
I welcome.
I think we will end the call. The next speaker is on.
Fine.
I would like to
I'm sorry. Yeah. We'll move on fast now. I'm sorry for the delay. Now, Dr. Prabhakar,